Have you ever noticed that you try to fix your posture, sit up straight, pull your shoulders back, and yet your upper back still feels tight, tired, sore? Sitting or standing with good posture feels difficult or hurts after a while, or even though you're doing the right thing, that your upper back tension just won't go away? Hi, I'm Alexis Wadeland, osteopath and nutritionist at Blossoming Me and Healthy Learning Lounge. Today I wanted to help you to understand why your upper back pain and tension are so often linked not just to posture, but how your ribs and breathing mechanics are actually working underneath that posture. Posture isn't just about a static structure. That is, it's not just about the right position. It's dynamic, affected by multiple things, and to be good posture, you need to not only have correct alignment, but correct fascial and muscle position and function as well. So if your shoulders are sitting in the right position, but you're pulling your muscles incorrectly, you might actually look like you have correct posture, and you might even think that you do too, but you may not really. If you can hold your correct posture in one position, but not another, or not during movement, then you don't really have good posture. Because posture isn't something that you do. It's something that emerges out of how your rib cage and your spine, your diaphragm and your nervous system all function together. Let's start with the rib cage itself. Your rib cage, the area of your upper body and thorax, it surrounds your heart and lungs. It has muscles, ribs, the spine, and it's not just a rigid cage. The reason that there are separate ribs is that it doesn't just enclose in a bony protection. Your rib cage is designed to move. With every breath, it allows you to bend and to stretch and to reach and to twist. Each rib has joints at the spine and connections at the front through cartilage and fascia or directly to the sternum. And there's muscular and fascial attachments that allows them to expand and recoil like a bucket handle and like a pump handle. When you inhale, the ribs should expand sideways, lift and rotate slightly, increase forwards and backwards. At the same time, your diaphragm should descend. The pressure changes between your chest and your diaphragm, and as that happens, your thoracic spine and chest should move smoothly. It should be an even distribution of movement, a three-dimensional movement which is stable and elastic, and it creates a stable base for your neck and your shoulders and your upper back. Now when rib mobility is reduced, which can happen with prolonged sitting, shallow breathing, stress, inflammation, previous injury, the whole system changes. Your ribs become stiffer, your diaphragm doesn't descend quite so easily or as much. Breathing shifts upwards into the upper chest and neck, and the thoracic spine begins to lose its natural capacity to extend, side bend, and rotate easily. From a mechanical point of view, this creates a problem. Your shoulder blades, they sit on the rib cage and they should glide over it comfortably. Now this depends on the shape and movement and position of the ribs themselves. If the ribs are held or compressed or elevated, or the rib sits backwards, then the shoulder blade is forced to adapt. The shoulder blade may be pushed backwards, outwards, upwards, ever so slightly. Then muscles such as your upper trapezius, your levator scap, your rhomboids at the back, the deep stabilizing muscles of the shoulder, such as the subscapularis, and the deep paraspinal muscles also, they will all have to work harder just to stabilize that area. Now this is often experienced as a constant ache between your shoulder blades, the feeling like you have to hold yourself up, fatigue in the upper back after longer periods of sitting or standing, or just at the end of the day, tightness that seems to return as soon as you stop consciously correcting your posture, or stretching, or pressing those tight stubborn knots that you might find. The key point here is that the body is trying to create stability on a foundation that has maybe lost some of its inherent stability that should exist when things are stacked up and connected correctly, causing joint restriction, muscle tension, muscle fatigue from overuse, and resulting in reduced mobility and ease of movement. With reduced ease of breath and or shallow breathing, the nervous system signals threat, and it begins to compensate by increasing muscle tone further. So you don't just get this mechanical issue, you get a neuromuscular cycle as well. Not only that, but your circulation and digestion are also affected. You see, when the ribs don't move well, the diaphragm doesn't get its full excursion of movement either. When the diaphragm doesn't move fully, three things happen. The change that's supposed to occur between pressure of the chest and the abdomen through breathing, that will support naturally our circulation and lymphatic fluid return, is greatly reduced. The pressure and movement of the diaphragm onto the digestive organs is also reduced, and this minimizes digestive stimulation and gut motility. And the stability between the thoracic and lumbar spine is also reduced. The diaphragm and other connective tissues connect between the thoracic and lumbar spines, and as your body moves, the fascial recoil that is allowed here helps to transfer energy between the upper and lower parts of the body. This then becomes ineffective. When this energy transfer is functioning correctly, it helps to propel us forward in walking and other movements, reducing our energy requirements. This means that deep postural support systems of the body will also become less effective if it's not working well. So it uses more energy, so you feel more tired, and it reduces your whole muscular system stabilization, so that lower back injury is more likely. As a result, more superficial muscles have to step in to provide support. These are the very muscles that tend to feel tight and sore and overworked in the upper back and in the neck. And they can't just let go because you stretch them or you push them with a myofascial tool. They have to work so hard because the deep muscles can't do their job. So while this setup is happening, you want these superficial muscles working hard. They are what's actually holding you up. So what do you do then? You want to help your rib cage to move and function better, to reintegrate those deep stabilizing muscles and the fascial connections of the upper and lower body, so that they can then take on their stabilizing roles again, and your superficial muscles can then finally start to relax and let go. This is what will allow you to feel freer, move more comfortably, and have a happy upper back. In simple terms, when your breathing mechanics are compromised, your posture becomes effortful instead of effortless. You might look upright, but internally you are bracing. Over time, this pattern can then lead to reduced joint nutrition in the thoracic spine and in the ribs, increased compressive load through the upper back and really through the lower back as well, heightened sensitivity of the local nerves, causing more pain in that upper back area, and a nervous system that associates upright posture with effort and strain and stress, rather than with ease and support. So on top of the upper back, shoulder, neck tension, and reduced mobility that you might already be suffering, you might also be more at risk of vertebral joint dysfunction, disc injury, and pain in, well, any part of your back. So that's why simply telling yourself to just sit up straight often won't resolve upper back pain. You're trying to correct a movement problem with willpower rather than restoring the mechanics that allow the posture to organize itself naturally, allowing you to sit up and stand up straight, almost effortlessly. You may have already noticed that your upper back tension and or your breathing changes with your emotional state. That when you feel calm, you can breathe more easily, but when stressed, maybe not quite so easily. That isn't a coincidence. It's a direct correlation between the rib mechanics, diaphragm function, and nervous system regulation. So when we talk about improving upper back pain and posture, we're really talking about 4 integrated goals: restoring rib and spine mobility, re-establishing efficient diaphragmatic breathing, reactivating the correct deep shoulder and upper core stabilizing muscles, which is essential for reducing the protective superficial muscle overactivity that you're probably feeling now, and allowing your nervous system to feel safe and in control again. To do this, in our assessment at the clinic, we will look at how each rib moves individually and as a whole, how the thoracic spine responds to rotation, side bending, extension and flexion, how the diaphragm and the abdominal wall coordinate with breathing and with upper body movements, how the shoulder blades and the shoulders themselves are positioned, and how movement is controlled, and how the nervous system is regulating tone and movement of the whole area. Because everyone's pattern is different, some people are more rigid in the front of the chest, while others might be more rigid in the back of the ribs. Some might have ribs that are held in elevation, while others are sitting in a collapsed position. Some have more compensation in their neck, while others have more compensation in their lower back. Understanding your specific pattern is what allows treatment and exercise to be truly targeted and effective. At the same time, there are foundational principles that almost everyone can begin to work with, gently, even at home. Reconnecting with gentle rib movement, restoring breathing patterns, allowing our thoracic spine to begin to move again, using all of the above to help the nervous system to read and signal safety, not threat. This is where structured, guided self-care can be incredibly valuable, not as a replacement for individual assessment, but as a way to teach the body how to restore these patterns consistently and safely. So if your upper back feels like it's constantly working to hold you upright, it's not because you're weak or failing at good posture or doing something wrong necessarily. It's often because your ribcage and your breathing system beneath your what appears to be posture need support and re-education. And when those systems begin to move and coordinate again, posture stops being something that you have to force and starts becoming something that your body naturally organizes for you, almost effortlessly. If this perspective resonates with you, it's worth remembering that there are different ways to support this process, depending on your needs and where you're at right now. So for some people, hands-on assessment and treatment are the most appropriate starting point, especially when pain is persistent, complex, layered with previous injury, surgery, or long-standing stress patterns. For others, beginning with gentle guided work at home, learning how to restore rib mobility, breathing mechanics, thoracic support in a progressive way is a safe and effective first step. And for many, the most powerful results come from combining both of these. That's why we work in these two complementary ways. Through individualized care at Blossoming Me, our clinic, where your unique rib, spine, nervous system, lifestyle patterns can be assessed and supported, and through structured programs like the Ribcage Reset mini course, which is designed to help you to relax your nervous system, retrain your breathing, improve your rib and spine movement, and reintegrate your fascial connections, either as a starting point or alongside treatment. If your body has been holding itself up with effort, especially if it's been for a long time, it doesn't need to be forced into better posture. It needs to be given back the mechanics and the safety that allows posture to emerge naturally. I hope you found this useful, and if you'd like more information like this, please feel free to like it, subscribe, share it with someone who might also find it useful. And if you would like to explore working with us further, either through individual care at the clinic or through our guided programs, you'll find the links below.